Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be discussing best practices for strengthening the tibialis posterior muscle. Now, we'll be looking at the reasons why you might want to strengthen this muscle when we get to the actions of this muscle in just a minute. But I think a lot of people who are going after this muscle for strengthening purposes are doing a decent job, but we could be a little bit more optimum with how we're going about strengthening it, and we're going to see what the evidence has to say about that. So without further ado, let's take a brief look at the anatomy and functions of the tibialis posterior. Now, the tibialis posterior is contained within the posterior compartment of the lower leg, as the name suggests. But within the posterior compartment, there are two regions, a superficial region and a deep region. The superficial region we've technically covered in a separate video. That was the gastrocnemius, both medial and lateral heads, and the soleus. And if you'd like more information on how to best go after those muscles, be sure to check out that on my channel. It is currently up. If we peel off the muscles of the superficial region, we're left with the deep region muscles, of which there are quite a few, and one of which you can see on the right side of the screen there is the tibialis posterior. One thing to know right off the bat is this muscle, being that it is so deep and honestly not very large, it's notoriously difficult to build a mind-muscle connection with the tibialis posterior, and so really having optimal exercise selection is crucial for building strength and hypertrophy in this muscle. Now, the muscle has several origins, as you can see right here. It's going to originate off of the posterior surface of the tibia, the fibula, and the interosseous membrane, that dense fibrous connective tissue that connects the tibia and the fibula. It's going to run vertically downwards, and it's going to insert on the navicular tuberosity, which is a protuberance on the navicular bone, all three cuneiform bones, the cuboid, and the bases of metatarsals 2 through 4. Now, its actions depend on which area of the foot and ankle you're talking about. At the talocrural joint, it's going to facilitate plantar flexion, which is obviously both in open and closed kinetic chains. You've got subtalar inversion, so in open kinetic chain, it's going to invert. Usually in closed kinetic chain for most movements, it's really going to act as a very important stabilizer. Okay, it's also going to facilitate forefoot adduction. And you can't have forefoot adduction without a little bit of tibial internal rotation. Understand that. And it is tibial internal rotation in open kinetic chain. When you're weight bearing or closed kinetic chain, it technically becomes femoral external rotation. But we're going to really talk about this in the context of forefoot adduction. And really when you combine all three of those things, we call it supination. So supination is a major function of the tibialis posterior. And then additionally, it helps support the medial longitudinal arch of the foot, and it's innervated by the tibial nerve roots L4 and L5. And those actions that we just mentioned give us several important reasons why we might want to go after strengthening of the tibialis posterior. Now, one word of caution here, and this has to do with flat feet or pes planus, often associated with overpronation, and high arches or pes cavus, often associated with oversupination of the foot. A lot of that is largely genetically determined. Some people are going to be much more susceptible to having pes planus and overpronation of the subtalar joint, and vice versa, high arches and supination, largely genetic. And in a lot of individuals, it is completely okay and it is benign, and there's not much you can do about it, and if it's not causing any pain, it's not causing any dysfunction, it's nothing to worry about. That's just how you are built. However, if your flat feet, let's say, cause you dysfunction, whether it's pain or maybe make walking and running or jumping difficult, if you have overpronation that's doing the same thing dysfunctionally speaking, and you have weakness of the tibialis posterior, particularly relative to the fibularis group on the other side, it might become important to strengthen this muscle up. And you can see in the image right here on the right side of the screen what happens when you have long-term weakness in the tibialis posterior. You end up with what we call tibialis posterior tendinopathy. And there are multiple stages, listed 1 through 4, that you can also see in the table there. I'm not going to take the time to go through the table, get into too much of that in this video. We'll be covering that separately, and you can certainly read about it online on your own time. But it suffices to say that when you initially develop a tibialis posterior tendinopathy, it becomes painful. And that tendon runs down the medial aspect of the ankle. So if you have pain in that area, particularly localized right on that tendon, which you can feel if you invert your foot while palpating the tendon with these two fingers. If you have pain in that area, it's likely that you have a little bit of a tendinopathy. Whether it's minor or severe depends on the level of weakness and depends on the pain. Now, it's important to get that looked at and treat that early on because, as you can see by that picture there, as you let this progress more and more, the tibialis posterior gets weaker and weaker and weaker, and ultimately you end up with dysfunctional structural changes in the subtalar joint, the hind foot, and the midfoot. And this is especially pronounced there in that picture for the person's left ankle. Now, I'll make the assumption that the right ankle is unaffected. It's hard to say anything about it without any context. But the right ankle, there might be a little bit of pronation there. There's a little bit of a collapsed arch, but maybe that's the person's normal, their baseline. But that left ankle, you look at that navicular, it's sticking way out there. That arch is totally collapsed. There's highly excessive pronation there. And that's what happens in a stage 4 tibialis posterior tendinopathy. You won't see that too much in the clinic, but if you see something like that, that's what you're dealing with. And theoretically, you want to catch it well before it gets to that point, because when you get to that stage 4, it's pretty much irreversible. Okay? Catch this early. Keep these tibialis posterior muscles strong. How do we do that? Well, let's take a look at our exercise selection. Here is a study titled Selective Activation of Tibialis Posterior, Evaluation by MRI. And they looked at 3 different exercises: foot adduction, the heel raise, and foot supination. And ultimately what they found is that selective and effective activation of the tibialis posterior during resisted foot adduction in persons with a normal arch index suggests that this exercise should be considered for interventions aimed specifically at increasing the force-producing capability, the strength, in this muscle and tendon. Now, it's worth noting that in this study they looked at healthy individuals. They did not look at people with significant amounts of weakness or tendinopathy of the tibialis posterior. But generally speaking, for the most part, if these exercises work in healthy individuals, it's very likely that you can translate this into affected individuals with either just weakness in the muscle or potentially a tendinopathy. And they found that the best exercise was the foot adduction. And that's what we're going to take a look at right now. Here you see resisted forefoot adduction. Now, this is an open kinetic chain tibialis posterior strengthener. It involves a combination of plantar flexion, which is isometric, adduction, and some inversion. So the plantar flexion is achieved by the fact that the band is essentially pulling your foot up at a 45-degree angle. So if you totally relaxed the plantar flexors, which is really the calf muscles and the tibialis posterior, the foot would essentially come up into dorsiflexion, which we don't want. So you're engaging the plantar flexors isometrically to essentially slide the forefoot over the ground. And then there's, of course, adduction because you're moving it inward, and that also involves a little bit of tibial internal rotation. And then there's a little bit of inversion sometimes at the end range there. But the whole goal of this exercise is to essentially sweep the bottom of your foot over the surface of the floor there. And obviously you can add heavier and heavier resistance bands this way and get more bang for your buck. When it comes to any of these exercises, and this is really important, somewhere along the line, there became this idea, I'm not sure where it comes from, that when you're strengthening these muscles, like the calf muscles, for example, and certainly these would extend into that, you need to do high reps. In fact, some people will just say, because they heard it online somewhere, you need to do 20 repetitions of heel raises, or whatever the exercise is. 20 repetitions, high repetitions, because our calves get work throughout the day, right? You have to do high repetitions. I can tell you in practice, this does not work as well as just simply treating the muscle like any other muscle of the body. If I wanted to build strength, let's say in my upper chest muscles doing incline bench, which I just did recently, I'm going to stick somewhere in the 6 to 10 repetition range. I'm not doing 20 repetitions. It used to be also that strength, they said, oh, you have to do like low reps, somewhere in the 1 to 5 rep range. Realistically, you can still build a lot of strength in that 6 to 10 rep range and use a huge amount of weight. As you start going up into the 20 repetition range, the load that you can lift has to be lower. And that's not optimum for building strength. So treat these muscles, as small as they are, like any other muscle of the body. Stick in that 6 to 10 rep range, 8 for me is ideal, and use the heaviest resistance band that you can tolerate. you theoretically want that 9th or 10th repetition, if you were to do those, to not be able to move through the full range of motion because the muscles are gassing out, okay? Use higher weight or higher load resistance, and you're going to get much more bang for your buck. Don't get in this 20 repetition type of nightmare, okay? Don't do that. Now, that resisted forefoot adduction, that is what they found to be the best activator of the tibialis posterior. A second best is just resisted inversion, which you can see right here. What I usually do when I'm doing this exercise is either cross my leg up or I just rest my thigh on the table, as you can see right there. And essentially you have one end of the band under the non-working side foot and you loop it over the forefoot of the working side and you just perform resisted inversion through a full range of motion. Now, when you're doing inversion, there are two inverters. There's the tibialis posterior and the tibialis anterior. Now, if you have the foot in a dorsiflexed position and you invert, that's going to get more tibialis anterior. So make sure when you or whoever's doing this exercise is doing it, that the foot is pointed like you're pumping the gas pedal. Okay? Pump the gas pedal, put it in some degree of plantar flexion and perform the inversion there. That's going to make it much less likely that the anterior tib's going to take over and put the vast majority of it in the posterior tibialis. Now, I see a lot of people doing this second exercise, resisted inversion. It's kind of people's go-to, but it turns out that it's not optimum. The first exercise, resisted adduction, is actually a little bit better. But if push comes to shove and for whatever reason the person just can't do the adduction one, whatever reason that is, you can always do the resisted inversion and it's still going to work for you. It's just not quite as good as that first exercise. Now, an obvious limitation of either of those previous two exercises is that they're open kinetic chain and there's a limit to how much load you can do. Realistically, we want to use as much load as possible because we're going to get more bang for our buck that way. And also, we want the exercise to be as functional as possible so it translates to our daily activities. Now, I remember someone once said to me, well, any exercise is functional, right? That's true. Muscle is functional. I mean, if you're building strength in a muscle, it should translate to other things, and it always does. But we want it to be as functional as possible. So most of our daily activities, which involve walking, maybe you're trying to jog, to run, to jump, hop, whatever it is, those are all in closed kinetic chain. So I would argue that from a functional perspective, closed kinetic chain is going to be better. And so that's where we're going to see some kind of heel raise with, usually you'll see a tennis ball, but I actually prefer something a little larger, whether it's a foam roller or a yoga block as I'm using here in this video clip. We're going to do heel raises with the yoga block. And the idea here is I put the yoga block between my heels, so it's pretty much on the ground at the start. And I'm squeezing my heels together. And I'm not just squeezing them together as I'm coming up. I'm also, as I squeeze, I'm scooping the yoga block up, okay? It's not just squeeze and come up. It's squeeze it and scoop the yoga block up. Imagine that your heels, at least on the inside, are ice cream scoopers, and you're digging into that tub of ice cream trying to get as much ice cream out as you can because you're trying to bulk, right? So scoop up that yoga block. If you're using a tennis ball, scoop up the tennis ball. Scoop up the foam roller. And that's how you're going to get the most out of your tibialis posterior with that exercise. Now, it's true. The gastrocnemius, the soleus, a lot of those other muscles, they're going to take the vast majority of the load. But what we want here is we want, one, the tibialis posterior to contribute as much as possible. And by doing that squeeze and scoop type of motion on the yoga block, we're maximizing tibialis posterior. But that also better facilitates supination as you come up from the bottom. Some people, when they're doing heel raises, whether it's on one or both sides, they're not getting adequate supination. They're kind of staying in a subtalar neutral position. If you notice that, this would be a great exercise to do because it more facilitates that supination, which you absolutely need to have a correct heel raises. Okay, and obviously this exercise can be progressively overloaded indefinitely. I'm showing this just on a wall, kind of in an FHL style heel raise, but obviously you could go and then do this at the calf raise machine at the gym and load 100 pounds, 200 pounds, 300, 400, however much you can do. And the more weight that you put on the machine, assuming you're doing correct technique and getting that supination, the more activation of posterior tib that you're going to get. So, hopefully this video gave you a good understanding of what the tibialis posterior does and how to best go and strengthen it. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.